Good afternoon. This is United Medical ACO, UMACO TV. My name is Kemal Erkan. Today is October 21st, Friday. As usual, this is our weekly updates from US news and also from global news, global events. Sean Donegan is going to join me later on. Today, we do have a special guest, one of our state positions, which is going to be there will be an election for that on November 2nd or November 3rd, the first Tuesday of November. Our auditor, future auditor, is going to join us, Lydia York. So I'm going to actually go ahead and let her in and not take too much time. And so we'll start our discussion. All right. Good afternoon, Lydia. How are you doing?
Doing well, thank you. Thank you for asking.
Well, thank you for joining us. We didn't meet before, so I just want to make sure that this is not one of those news channels. I guess we are business-based and we are in healthcare. We do bring our state officials time to time, but you and I, we just talked once on the phone. I did not have your phone number. I got it from one of our other state officials.
Okay.
And you were so nice to accept our invite and join us. Now you are running for an office I wasn't sure if it was November 2nd or the 3rd, but what's the date actually? The Tuesday, the first Tuesday?
The election day is November 8th, but early voting starts on October 28th, next week.
I was way off then. So but it's the first Tuesday, right?
Yeah, that's election day, first Tuesday. They'll count ballots that night. But Delaware enjoys early voting that's going to start on the 28th.
That's great. So we wanted to get to know you a little bit because honestly, even including myself, we didn't know who you were. Now I have a little bit of idea because we were preparing for this event. So if you don't mind just giving us some background, what do you like us to know about you?
Oh, sure. I've got a stump speech, or basically something where I introduce myself. And what the most important thing I think people ought to know about me is that I am qualified for the work that's part of this office. I started my career actually as a CPA in public accounting with one of the now Big Four firms. I also went to the Wharton School. I have an MBA with a concentration in finance and spent several years, working in financial, I hesitate to call it financial management. It was financial transactions. Of a structured nature. And in fact, that's how I came to be in Delaware. But my family says I slipped and bumped my head and eventually went to law school. I attended Temple University and I liked it so much I didn't stop with a JD. I got an LLM in taxation as well. So I've had a lot of formal education. Most folks in Delaware know me best as an attorney, where I practice in estate planning, but with a particular emphasis in elder law, which people ask me, what's that? And I said, well, it's the law that applies that people don't even think about because it won't apply to them unless they're actually already over 65. And that includes issues around, in my practice, Medicaid, planning, and how to get that process going if in fact that's what you need. I like to tell my clients that I don't think of them as old until they're 80. So that's
I'll change my settings to that.
Okay, yeah. I mean, once you're 80, yeah, you really are old. But I think that, I've learned quite a bit in terms of, as I said, the issues that only affect older folks, and some of them can be planned for, but most of them you sort of encounter as you're in that age cohort. And as often as not, it's a bewildering world because I used to describe it as it's a Harry Potter reference. It's kind of like Diagon Alley. It's always there, but the way you get in is a little odd. So
actually, you are not that off with this age. Like as you know, we are an accountable care organization from our healthcare provider standpoint. A lot of primary care. We provide about 115,000 patients. We provide services for 115,000 Delawareans at the primary care level. one of my early experience was with the population we have. With the Medicare population, we all know that 65 and over is the majority of the Medicare patients, but we were trying to kind of focus on certain maybe age groups to see if we can actually control or manage those patients better. And I said, well, why don't we just run a report for 85 and over? So there won't be too many patients. So I was wrong. So almost 20% of our
Right.
Medicare population was over 80 years old.
There are, the life expectancy has stretched outward in a way that I don't really think our systems have accommodated, actually. A story that I do like to tell is that as an attorney, a couple of times a year, I go to an update conference around Medicaid qualification. And one of the years I went, in fact, it was in March of 2020, so I remember it very well. One of the statistics that they sort of threw out there at me, and it was because it was around literally planning the practice and how you approach things. And they said, well, very casually, you're going to live about 20% longer than your parents. And that left me shocked, because even if I took the average of my parents' ages, that put me over 100, and depending on exactly how you want to figure that out, maybe even past 110.
Well, that may be the new reality.
And so what that said, what they were trying to explain to us is that you ought to be planning a longer work life. You ought to be planning a little more carefully about the decline years, because it is a form of decline once you get out there in there. And as I said, on the upside, I said, gee, I'm only middle-aged. But we are living longer, but we have this idea in our heads that we're not going to live much past 80, and that we'll be healthy until we die.
So I think the best is to kind of, I always tell my team here, we need to update our settings time to time to make sure that our defaults is not like maybe 20 years ago, 65 was that age of being kind of like old, but now 20, 25 years later, like these days, now if someone is like 75, I don't see that person as an old person. My dad is 81 right now. He's at the beach house. In the last 4 weeks, he's by himself. He has some help coming, very limited, but he does everything on his own. He's 81. He drives his own car. This is like 5.5 hours from our home. And when we try to give him some help, including driver, he refuses it. So he says he's an independent person. So.
And to be sure, to the extent that it's safe both for them and for the community, I encourage independence, because as I tell people, I use lots of metaphors. I said, it's a one-way street. And once a skill or a capability is lost, it's probably gone. Mm-hmm. You don't want to hasten it, with, learned helplessness, so to speak, but it's a process that, as they say, it's gradual until it stops being gradual and starts being sudden. True. And as a planning metaphor, in terms of the planning I would do around Medicaid planning, I said the crisis is only a sped up version of planning. Because as often as not, something occurs. There's a fall. There's some kind of an accident. There's a sudden or sharp decline in health. And then we are in crisis, but we could have taken some of those steps in planning.
So one of my providers, she's on vacation in Philippines, and she's watching, and she wanted me to let you know that she's watching. So even in Philippines, they're watching us right now. So that's a good thing, right? So one thing that I want to tell you with this discussion that we are having, your private practice, I just want to open that up maybe a little bit.
Sure.
Because that's kind of specialized in that estate planning, right. It's called like probate services, right?
Correct.
So can you educate us on that a little bit? Because most people, again, because this is a healthcare news, advanced care planning is where we are lacking a lot. many people don't understand. They think that advanced planning is whether you have a will or not. It's not. So advanced planning is much more than that. And it is part of our accountable care organization quality metrics. But I think there's a still misperception of what it is and how it should be documented. I don't believe people are really understanding that. If you can, please provide us some education on that.
Sure, I'd be delighted. So a lot of times when I'm talking to folks about planning, and we'll call it just broadly estate planning, and one of the early pushbacks is, well, I don't have an estate. I said, no, estate planning, at least for me, and at least in the eyes of the law, is a technical term. It's a highly technical term, actually, and all we're trying to do is to plan for what happens with your stuff after you don't need it anymore. Yeah. Okay, and it is better to have a plan if you've got anything at all, and I tell, and this is especially for people who own real estate or have a lot of cash, and sometimes that's the same thing, but the law treats those things differently, and pretty much across all 50 of the United States, for sure, and its related territories. If you own property, the state has an interest in who it goes to. And so if you don't tell anybody who ought to have the property, it's going to be divided among your heirs. And people say, I don't have any heirs. I'm like, yes, you do. Because heir is, again, another highly technical legal term that means someone who's related to you. So most of the times that's going to be your children. And if you're in my case, I don't have children. My nearest heir is my sister, and then her children, which does make some sense. But that's in a, let's call it a cohesive nuclear unit. If you, and it assumes, as I said, this area of law, at least in the English speaking world, is a little over 1,000 years old. Created in a time where there was one man, one woman, one time. Okay, so it used to be very simple, but at least in the United States, that doesn't describe half of all families, at least, okay? So the question of who inherits starts to become a little more difficult. And then this creates what I think of as a problem with transferring wealth from one generation to another, because we haven't really adequately explained or haven't told the law who ought to control that process or what ought to happen, as I said, once you're not using it anymore. So, for example, if I did not have a will, right now, my property would pass to my sister. But my sister is even older than I am. So that's not, in my mind, an appropriate person to inherit, because statistically, she's likely to pass before I do. Her children are the more natural heirs. And I can certainly target, I can certainly say her children should inherit my estate. I can say that, and the law will uphold that. And it's not to cut my sister out. It's just a matter of, statistically speaking, I'll probably outlive her, and she's probably going to live a long time also. Absolutely. And so the rest of estate planning, though, and this is the part that I think people forget, that's what happens after you've passed. Part of good estate planning is planning for while you're still here. And there, I'm talking about two very specific documents, the healthcare directive, which I think is relevant in this conversation, about how you want to be treated when the patient can no longer make those decisions. And I am also speaking about, I would call it generalized healthcare. I'm not talking about necessarily the end of life decisions, which you ought to be planning for anyway, but for who is going to make those decisions. Okay, so that's something that you can plan for, because, and it's important that you impart how you want to be treated. Most of my clients, and in fact, there's so many that I have it literally in my boilerplate, like standard language, they want to be kept comfortable and they want to be allowed to pass peaceably, okay? But I have some clients, I've had two, who have insisted on the full panoply of what medical science can offer them to keep them alive. And those are choices that they're allowed to make. I checked, I double check, I triple check, because that's a really big it's inconsistent with my general experience. So I just make sure that they understand what it is they're actually asking for.
That's why I was saying earlier, this misperception. They really don't understand what may be happening, and also responsibility that we leave for those who may not have good, clear guidance. So, like I have three siblings. When my mom actually was going through her COVID time, it was so scary because we didn't know what was happening. This is in 2020, end of 2020. We were all worried about what may be happening. My dad was at the beach house again, and he couldn't actually travel back because of the COVID situation.
Mm-hmm.
So between the four kids, luckily I'm really close to my two sisters, but not so close to my brother. So now if we have to make some decisions regarding her health, things were it was going to get rocky. And this is until you actually have it, people don't understand what it means. But I think being proactive to prevent certain crises or making the crisis even bigger, they really need to take an action early on and then make sure that they are prepared for those days.
And it could, and I as we were coming out of COVID, got some, additional, I'm always open to talking, listening to other practitioners. And at least in the state of Delaware, there was a sort of a big push to get people to really be clear about this. And they sort of talked about the degrees, how much planning do you have to have in place? It's like, well, when you're healthy, you just need to identify some people for just in case. But as your health continues to decline, and if you're on a path where, there's an end that's foreseeable, you need to make different kinds of decisions as well. And you need to be very clear about them so that we don't create a crisis among the not healthy, among the healthy, to deal with the not healthy person, because that anxiety is only going to, disrupt the vibe, so to speak. And it's avoidable. And then the other piece of the document is, or not so much a piece of the document, the other last piece of planning for while you're still here is a durable power of attorney.
Mm-hmm.
Okay, because a properly drafted durable power of attorney, and I'm using that phrase completely, durable power of attorney, meaning that it will survive your incapacity, which is becoming the really important thing, because if it expires with your capacity, the people they may have trouble making some kinds of decisions on your behalf simply because there's no authority for it. You can get the authority, but that involves the courts. And that change, that's going to be a jurisdictional issue since folks are listening around the world, but it's also going to take more time, most likely at a time when you're dealing with other things, and the whole legal process is going to be a frustration. And it's not going to get you to the best result. Let's put it that way. It'll create a result, but it's not going to be the best result, and it will take time. And even under an expedited basis, it's going to take a couple, 3 days.
Absolutely.
And so,
hopefully, folks who are listening to us, they can also take some notes from the discussion that we had, because we really wanted to talk about your future position, right? But it's a great conversation that we are able to, provide these necessary information, especially when it's related to their healthcare, which always comes down to something about healthcare. Now, the position you are running for the person who was in that position until last week, I believe, or this week, I met her once on the live event, just like this. Okay. And I don't know much about her. The reason we brought her up to the event was what she did with the pharmacy expenses, because your position, nature of your position is you are overseeing or auditing, reviewing the state expenses, and healthcare is one of the big ones. And I think the pharmacy item was a big one. And when I saw that in the news, I thought it was an important one to share with everyone. And I didn't know anything else about her, so I never met her after that.
Okay. Well,
so now we don't have the position. Actually, is just I think governor just appointed someone just today, if I'm not mistaken.
Right.
So
I'm going to be unclear on exactly the exact timing and nature of it, but the former auditor resigned. I believe it was effective Wednesday afternoon at 4:30. Yesterday, Governor Carper announced that he was appointing an interim auditor by the name of Dennis Greenhouse, somebody who had actually held the position previously, and will hold it until there's a new auditor to take office in January. So part of why some of that happened as quickly as it did is because there is some outstanding work that needs to come out of the auditor's office.
Sure.
That's important and apparently critical to.
Yeah, and things are going to happen. I guess that we don't have much details on those, but you challenged her for the primaries.
Yes.
Which normally it does happen, but not so common, right?
It is uncommon. And
so what prompted you to do that?
Well, what prompted that was that, as I'll freely tell people now, that last year around this time, she was indicted, a criminal indictment. Mm-hmm. And that's pretty serious. And there was an expectation that was held into this year, mm-hmm. That she would accommodate that fact, and to preserve the operation and the integrity of the office would diminish her participation or actions in that office, so that and so that she could more fully pay attention, and deal with, a criminal indictment is a serious thing. Even if it is simply, it was for misdemeanor at first, but it was re-upped, re-indicted with a felony. And so, frankly, I'm a Democrat, a loyal Democrat. We were looking at the possibility of having an indicted public official on the ballot, which frankly is not the brand of the Democratic Party. And because of what I did, or used to do in the party, in terms of knowing people and asking people, and as we say, our job is to recruit, select, and elect Democrats. I was on the recruitment angle this time, and I think someone saw all of my CV and came back and asked me to run, and I said, okay, I'll think about it for a bit, and I did think about it. And like I said, you've heard my background. I have the background for it. The only real question was I willing to enter electoral politics, run for office, and tell everybody to vote for me and make donations to my campaign. And after some consideration, I decided that for sure in the primary, and like you said, it's unusual for there to be a challenger to an incumbent. Especially not one that's being, frankly, supported by the party. But we felt so strongly about the situation that the party didn't want to let it pass. I did not want to let it pass, because I said, the potential for someone to be on the ballot that has that mark is just literally inconceivable. And I would suggest that Democrats up and down the state agreed with that position. Is that
no, that actually makes I understand exactly what you're saying there, and it makes perfect sense. Quite frankly, when the news came out, I was expecting her to resign then, but I think because something like that is not going to really come out unless it's serious, and it's in her position especially. This is a position of being the auditor of everything else. So then if you are being in question, that's not going to be the right thing to do if you were to stay there. I mean, if someone must stay there. So it was a little bit late, but sometimes everything happens for a reason. Maybe if she did it too early, maybe you weren't going to run for this, right?
It had, there's all kinds of alternative scenarios, but, had she, say, resigned at some point, it would have, I doubt that I would have decided to run for office, because I was actively trying to find someone else to sit, to run for that office. Yeah. But when there was both a trial date, mm-hmm. And she had filed to stand for election again, that was alarming to me, just as a citizen, that what are we doing here? And
No,
so,
that makes perfect sense. And again, sometimes these things are just meant to be, and the timing. Although we want people to do the right things, what I see, people try to push their limits until things are really not happening, and then maybe it's good to see that because the reason I'm saying this is because. If this was to happen too early, maybe we weren't going to have this talk, and then maybe you are the perfect person for this position, and that wasn't going to, come out. So we don't know. So because that's kind of like, I guess, out of our control. Although I was disappointed with her decision to stay as long as she stayed in this position. Now, we talk about everything, but we really didn't talk about what does the auditor do? Like, it's kind of like maybe for some it's self-explanatory, like auditor, but what do you audit? Who do you audit?
okay.
And what's your jurisdiction? Like, can you audit the governor like directly? Or is it like, what are the limits there? If you can give us some education on that.
Sure. So the limit, the authority of this office is described in a specific statute here in Delaware. And the statute itself is very broad. It basically says I can look at all the financial transactions that the state's a party to. Okay, so that would include, among other things, the executive branch. It includes the judicial branch. I'm sure it actually even includes some spending. The legislature doesn't spend a lot of money. They direct everyone else to spend the money, but it's very broad. And then there are some specific statutory things that they're charged with looking at. And in the case of Delaware, that's specifically the school districts and the Department of Education. And that's that's an important thing to be done that perhaps hasn't been done. And so lately, this week, I have been, and I'm use metaphors a lot because it's, like auditing is not terribly exciting, but I use the metaphor of the Tin Man from The Wizard of Oz. Okay. He had a function. He was out in the woods and he was rusted up. Okay. And he was perfectly capable of movement, of being the woodcutter, but he was frozen. He hadn't been oiled lately. And that's the metaphor that I'm drawing with the auditor's office, is that it hasn't been oiled lately. It's probably perfectly capable of doing its job, but we need to shake off the rust. We need to get it properly resourced. And then we need to make sure that we're living out to the statute's boundaries, and then to come back and do what I think is the real function of this office, how it's intended to actually work, which is to reassure taxpayers and others that the money that's been allocated by the legislature is being spent as it was intended. And so while I doubt we'll find, deliberate, misfeasance and malfeasance, we may find that money's not being spent as it's directed. And so, I'm telling everyone, earlier this week, I was at a community event, and I was there with a state representative, a city council person, and in this case, the state treasurer was there. I think, because she is also a healthcare professional, and had been in that building during the COVID time, initially testing and then vaccinating. So she knew the people in that building. So I think that's why she was there. And eventually someone stood up and asked a question that went something along the lines of, there was money allocated in the budget from the state for this building. Is there anyone who can tell us where that money went? And they were addressing it to the state treasurer because they had a relationship with her. But I interrupted them and said, I understand you've directed that question to the state treasurer. I said, but I think that question's better directed at the state auditor's office, because that's actually what we do, is tell you what happened. And while the office itself has no authority to do things or make things happen, we have almost unlimited authority to ask questions of what happened.
Mhm.
And, so I told myself, we're going to figure out what happened, and then I'm going to tell your elected representatives what happened, and let them figure out what to do about what happened.
Sure.
Okay. And I think that is the function of this office, is to tell us what happened. I'm going to come back to the school districts. I know it's not necessary, for just a real quick minute. That's
I mean, just to kind of insert something there, the school district, the Department of Education and the Department of Health are the two biggest expense items for the state budget. So I just want, like, when we say school, the perception, unfortunately, becomes a reality in many cases. And I feel like my job at time to time, while I'm doing my actual job and in my life, I have to just correct people. I'm like, no, it's not like that. It's this. That's just a perception. So the Department of Education is either number one or number two between the healthcare. Between two of them, they are almost 55-60% of the total budget.
Easily.
Right? So this is so important from that point. So
it's very important, and it was so important that there's a specific section in the statute addressing the school districts.
Yeah.
Okay, and just because it did not mention, some of the other expenditures directly, I don't take it to mean that it's, that if I audited all the school districts, I could stop right there. It's in, the authority extends to all the state agencies, all the things, it extends to all the money that the state actually spends. And, but back to my 10-man metaphor, it's been rusted up. It hasn't been getting done. And there are a lot of reasons why it hasn't been done. But I think that because those reasons, this is where the lawyer in me is coming out. It's like, just because we have an explanation for why it hasn't been done, doesn't mean that that's an okay explanation for not doing it now.
Of course.
And so, if the issue is that there's not enough resources allocated, well, then that's why why this position is elected, so that as a political matter, I can go get the funding that's necessary for the office to fulfill its mission.
No, that I think the analogy that you use, the oiling the machine. So this position probably does need that. Now it's an important, almost kind of like an independent position in ways, because although you may be appointed by the governor in the cases like just happened, you are actually auditing all of his offices.
Exactly.
Therefore, you are auditing him. So that's a really it's a pretty powerful position in that case, and that makes it even more important who's going to actually run and who's going to actually represent us. I think one of the things, Lydia, when I was kind of just reading your bio, like first just looking at the position, this position requires someone with accounting. Someone also knows the legal stuff. And then I didn't actually know your accounting one. Again, that's the perception, because I thought you were a lawyer initially, until we read a little bit more. And in my head, I had this like step by step. I'm like, okay, so this makes perfect sense for this person to be the auditor, the future auditor. So that makes it so much easier for me to kind of, process, because qualification of these state elected positions, in some cases, people who don't have the right background, they apply and they run for these. And that's actually extremely problematic in many cases, because that's where we make a lot of mistakes. And I was happy to see your background, your bio, having someone like you to represent this position and do this. I think that's extremely good and important for all of us. Now, but for anyone else who don't know you, and maybe like they're kind of in the middle. And you are going to run, who's the person you are running against?
There's a Republican on the ballot. Her name is Janice Laura. She's also a colleague. She's an attorney as well. And it just so happens, I think we're in adjacent neighborhoods here in Delaware. So it's somebody that's, in the neighborhood nearby, apparently. I think that there might, because there are rules that need to be followed. Okay, that's the end of it. That's the gist of it there. I can see why, an attorney might be interested in this office, but I think that its charge is based and rooted in accountancy. And so it's really, I think, important to understand what it is that's going on, what the work that's getting done, so that you can both direct it from I don't need to do the technical direction, I really don't, but to understand how it's going is actually pretty important. And I think that the whole system, the whole government would be well served if if we continue to lift up the leaders who can do the work. Absolutely. And I think that that's an important, at the end of the day, in our system here in the U.S., that's what the political parties are supposed to be doing, is finding people who can do the work and then supporting them and making that pitch to the voters. And so that's what I think about that.
From the personal experience in the state of Delaware, and Sean, we can actually, I'm going to bring him in so then, because he does these with me. So one of the things, we do invite everyone, but the state Republicans, you don't have to agree or disagree with this one, so it's just my statement. I think they're just lazy. They are not actually even answering some of our. We want to actually have variety, diversity with these discussions that we have, and we don't want to just represent one side of what's happening. Not just for this, like we didn't actually do anything for this one specifically, but for the other events for the state senators, we invited at least 3-4 different people with 2-3 different invites. They have no interest. And Sean, who's also just like me, he's also on the independent side. He can tell you directly, but it's interesting that they don't come back to us.
Yeah, I mean, you'll get a variation where some you'll just blunt no response ever, and some people will be, oh, we'll reach back out, in the fall or in the spring, whatever it happens to be. And we do follow up with multiple emails, and then again, it's just hit with this cold, no interest. But as you're mentioning, you feel like it's their duty to represent and at least give their opinion and kind of give us feedback on how they see things playing out and what changes might need to be made, regardless of the topic. We talk about various different things on our show, but
so it's just interesting. Yeah. So I mean, if it was just me telling you this, it would be maybe I could be maybe biased, but usually Sean sent those invites out, and it was his observation saying that, like, surprisingly, they're not coming back. So this is open for everyone. So we want people to be able to have a discussion and debate. And I know you are going to be fine. I don't think you are going to need a lot of luck, but we don't want to take anything for granted. So people should go out. They should vote. Voting is an extremely important responsibility for anyone who lives in this country. And then we're hoping that turnout will be good. Now, if you don't mind me just asking a couple other questions. Right now, there is this expectation for the recession coming out in almost every discussion that we have. The world is kind of changing the way that it was maybe before pandemic versus now, pandemic plus the different war that's happening. So what's your outlook in terms of the things that are happening today?
So, not to hit it too hard, I've been around a long time, okay? And I remember very clearly how inflation played out in the 70s. And inflation in the 70s was most definitely what they call a pull event. People were raising prices because they could. And frankly, monetary policy, people, governments are always loath to slow down economic activity, okay, until they couldn't do anything else. Because I remember, one of my early experiences when I was in public accounting was before we had calculators, we had sheets of numbers that we could use to figure out interest rates on a daily basis.
Right.
Well, the interest rates ran right off those charts, and we actually had to do the physical calculation so that we could do that work. The chart ran to 20%, but interest rates on the short-term basis were running to 23 and 24%. And that created eventually a very sharp recession in the early 80s. And at the time, I was living in Pittsburgh, Pennsylvania. And not that I would say that this caused the demise of the steel industry, it only hastened it, quite honestly. So let me flash forward to now, 2022. A lot of this, first of all, this inflation seems to be literally worldwide. Yes. And it's very difficult on a worldwide basis for economies to coordinate in a way that will bring down the inflationary pressures when we also have a war in the European continent going on. That's something we've been fighting. We've been trying to avoid that for quite some time. And we have a principal manufacturer, let's just call that, China, that is still working their way through COVID protocols and disrupting, so many supply chains run through and around China now that when their economy is disrupted, it might not necessarily disrupt other economies, but it will disrupt individual things that are occurring. I'm just going to indulge me here. Campaign road signs, okay? Yeah. I don't know if you've noticed, but there's not nearly as many as there were even in 2020, let alone 2018.
Now you said that, yeah.
Okay, yeah. And why? Because the paper that's used to make those signs is difficult to come by. And when you find it, it's really expensive.
So for the 2024 election, we need to get into that business to make sure that there is enough road signs.
You might, but it's the issue with supply chain. And I think at one point earlier this summer, the problem was actually the ink. They had the paper, but they didn't have the ink. So these delays work themselves. We got used to the just-in-time economy, where you could get strawberries year-round. Where you could get whatever you wanted, if not necessarily online, you were going to have it in the next handful of days. Amazon was promising you, next day delivery on pretty much everything you wanted. And then we had the pandemic. And that did a couple of things. One was disrupt all those supply chains. But the second thing that it did was to make labor a scarce resource.
This is so important because, like, in our we also own a surgery center called American Surgery Center. You probably see our billboard on 95. We are right in North Wilmington. So the supply chain issue can be extremely critical for hospital settings, surgery center settings, and we are kind of used to that time to time when we have these hurricanes. There would be some temporary delays, but this time it's a different one. So I used to have a conference room there. We don't have it anymore because they use it for storage. So just to prepare for what may be coming on our way. So
exactly. I mean, it's the way we do things. Like I said, we got used to just in time. Inventory levels were pressed to relatively low levels because you could always just get it. But the process of getting it, I've got a good friend that works for a Chinese manufacturer. So she's always upside down. I talk to her like first thing in the morning when she's trying to go to bed. And things just take longer. Everything takes longer. And then there's less of it because they don't have as many people working to produce it. And so let's talk about, let's talk about the current economic condition. I'm not quite sure to call it recession, because with recession, I expect to see employment levels fall. Okay, but that hasn't been happening. In fact, we're still growing. We're not growing as fast as we were this time last year, but employment is still rising. And like I said, for all the experience I observed what happens with recessions, because it's not just the one that was in 80. There was another mild recession in the early 90s. There was a mild recession in the early part of this century. And there was a much harsher recession, okay, in 2008. And in each of those circumstances, you had less employment, always just less employment. This time, that's not happening. So it's a little bit of a head scratcher, but the inflation, we can't fix it alone, because some of the problems that are causing it are harder to fix as well, in my opinion.
So no, that's actually, you just had that really, the point that I was trying to make, like these Friday sessions, we covered these, the way that you said it is just like validates what we were just talking about last week. Actually, I asked Sean if he's able to put something a little bit simpler for me to tell people what we have today is uncommon, unheard of. Like the issues that we are going through, the crisis that we are going through is not something that we had 20 years ago, 15 years ago, or 50 years ago. This is one of a kind, and with the old solutions, old tools, we won't be able to fix the problem. You are absolutely right. So there's recession discussion happening, but the unemployment is maybe one of the lowest. Well, I always explain that because people do need more income, so then they have to just take whatever job available, or maybe in some ways the definition of these terms are changing too, because from a healthcare standpoint, I'm in the central business office. Hiring is one of the biggest challenge for us. So hiring new people, even getting applicants is so difficult. So then I know that there are not too many people who are there without a job. So, and this is very unique. You are absolutely right on that, and that's why. I do urge people to kind of look at these issues a little bit differently, from a different perspective, to understand why we are here today. There's this supply chain disruption, the loss of 2 years not being able to produce anything or not doing it at the right level. These are the biggest problems. That's why we are here today. And you are 100% correct. So it's a different type of crisis that we are not familiar with.
I mean, it was, and honestly, and I tell people, I said, I'm less, I shouldn't say less concerned. This is a superlative matter. I'm less concerned about inflation, and I'm always deathly afraid of deflation, because Japan got caught in a deflationary cycle in the late 90s, and they're not out of it yet. And while they've been moving along and making progress, and the people are okay, I'm not sure how that would play out in a place like the United States or even in Europe, to enter a period of extended deflation. Sure. And so the problems are stickier, and I've been I'm literally preaching this all day today. The conditions in the labor market have changed in a significant and I believe permanent way. And the sooner we understand that in our planning approaches and all of that, the better off we'll all be. And I tell people, I said, I remember the oil shock in the 70s. And overnight, gas went to like $1 a gallon from roughly 45 cents or thereabouts. We got over the shortage, but we never got back to 50-cent gas.
True.
And I think that's something like what's happening in the labor side here. We're going to get past this shortage, but we're never going to go back to, quote, cheap labor.
That's very true. Very true. Now, I do want to thank you for taking time and talking to us. And I do want to, in advance, I do want to congratulate you. So I don't think there will be any problems, and I think you'll get it. Now, let's make sure that November 8th is the election date. So not the November 2nd or the 3rd, so November 8th.
I mean, they can go to the 2nd or the 3rd, but that's called early voting, and they have to go to a specific location.
Right. So now we know that you are a fan of Wizard of Oz. Now you are a good accounting, you have a good accounting degree, you have an MBA, you are a lawyer, and you work with the elderlies to better understand the our Medicare population. And I believe this is going to be an upgrade for us to have you in that position. So I think the oiling is on the way, and I think you are going to do a really good job. And again, thank you for joining us.
Thank you for inviting me. I've had a great conversation today, and in future, I would love to return.
Absolutely, absolutely. So we'll see you after the election then.
Okay.
All right.
Take care and stay safe.
Bye-bye.
Bye-bye.
All right. So another great conversation. So I think Lydia York, again, we never met her before, and just trying to get these people know in these live events, it's a different type of an experience too, because we really didn't know anything about her. So we tried to get some, in fact, we didn't even get her age. Like you were trying to Google it and I was trying to look at it and we couldn't. So we don't know much about the person. So it's interesting how much we can actually learn with this event. And I was kind of admiring ourselves. So good job.
Yeah, I think it was great for her to accept the invitation and, come out and be open to, open floor of questions, especially someone who's still pursuing as a candidate, this position. I think it's great for her to volunteer.
She's very good. I think she'll do a really good job. Now we have our other items. We may not have a full session, but let's make sure that COVID update is important. So if we can actually cover the COVID and
so our COVID update is continuing with the downward trend. The first slide you see here, though, is just an update from the CDC that actually beginning on the 20th, that they're going to no longer report the regular intervals that they were, and it's going to be a more rounded and less frequent reporting on those numbers. So it may be slightly delayed when we keep tracking these numbers in the future, but it's going to be not as precise and as frequent as we're used to seeing. So they did have that disclaimer, I guess a heads up, you should say, not a disclaimer, but so just keep that in mind going forward, that the numbers are going to be delayed and kind of more grouped.
So it's not going to be up-to-date numbers.
Yeah, it's not going to be as frequent of updates.
Well, that may actually change since we are going into the season, the winter season. From my hospitalist experience, I ran that for almost 15 years. So these are the internal medicine doctors who work in the hospital only.
Yeah.
So they would appreciate this the most. Many people don't understand how winter season is affecting the capacity at the hospitals. And especially when we are just coming out of this pandemic, which we are not fully out yet, things are going to be still up in the air. And then it's too early to make any permanent changes. We were in Kansas City first time in person at Oracle Cerner health conference, and I was a little bit worried about how people from not having anything in person to being in a room with 350 people, capacity 250. So that's concerning. That's why I'm thinking that I think people need to be more careful and not to hear and listen everything that they hear. So that's going to be important. Now, speaking of Cerner visit, Oracle Cerner visit. Yeah. So this was again, the COVID has a permanent impact in our lives, I guess. So our habits change. Everything that we do is different now. So this was the first time after 2019. And we had 12 people. I was actually for American Surgery Center for outpatient surgical practices. I was one of the panelists for one of the events, so it went very well. But I think I missed this part of the in-person interaction, being able to spend a little bit more time with our people. This was kind of our retreat. Now, like until 2019, that's how we were actually doing it. So then all of a sudden, when you didn't have it, you can feel it. There's a big, big gap there.
Sure.
So everything changed, traveling changed, expectations are different. So hopefully we can keep doing that. And I just want to make sure that people are still though more careful with how they are interacting with the rest.
Yeah, definitely.
So now we are reaching to an hour. So we have, do we want to go through the global events?
I mean, yeah, I can touch on just some of what we were seeing.
So one thing on the COVID-related issue that I maybe I was going to read it a little bit more. Something that I read in one of the laboratories in Boston, they were able to
produce the variant that was more deadly.
Yeah, I just didn't understand what triggered them to do that, or if it's something that's.
I hope it wasn't intentional. I mean, it might have been trying.
It sounded like intentional, but were you able to read anything?
I was assuming that it was that they stumbled upon it while perhaps trying to do further testing on other vaccines or different variants that they think maybe possibly come about in the future. I'd hope that they didn't intentionally try to combine and create a super variant intentionally. Obviously, that wouldn't help anyone, but
right?
Yeah, you'd certainly hope they didn't do that, but definitely something concerning that the fact that it could exist out there, and we're saying they caught it in the lab early on, so you'd hope that they are able to contain and also develop a vaccine maybe that kind of aligns with that new variant.
Sure. So now the one of the things maybe not COVID related. I'm just going through some of the stuff, and because of the election, we'll have some maybe extra sessions, extra episodes.
Yeah.
One thing that I wanted to actually, which you did already prepare, that I do want to share, because we keep telling people prepare for what's coming. And Sean was nice enough to listen to me, and he put something together. So I'm going to share that. So when we say prepare for election, I mean not the election, but recession. So we talk too much politics. So just to kind of have an example, like what are those things that we can do immediately? Some we are able to, some we are not. Let's go over that very quickly and then see if we can help those people.
Yeah, so just the 5 bubbles here, just some common ideas and practices that may be able to help people who, when we're saying prepare, they're going to say, oh, well, how? So here we go. So the top left, we have to review your credit card balance and kind of just sift through that and see if you can differentiate some of the purchases that are wants versus what are the needs. Obviously, your utility bills, groceries, gasoline, get to work for your car, your maintenance or oil changes, things like that are going to be your needs. But we know that, say Apple released their newest iPhone not that long ago. Maybe if your current phone is working fine, you don't need to go spend $1,000 on the new Apple iPhone.
So if you're referring to my new one, it was an upgrade. It's free.
That was a need for Kemal, so so. But yeah, there's certain areas where people can definitely cut back. Also maybe just not going out. We'll see on the right, top right says a frugal lifestyle. So maybe you don't need to go out to a fancy restaurant, twice a week, and maybe a home cooked meal or buying groceries that can help people save a little bit there. And then in the bottom left, we have to create an emergency savings. Typically, your advisors will say 4 to 6 months of expenses, because you never know what could happen with an emergency, whether it's a medical emergency, a situational, get into a car accident, you have to finance a new car or something, or maybe a loss of job. So 4 to 6 months, that way you have some type of savings should, an unexpected life occurrence happen. You're able to at least withstand that for a few months' time. And then also in the bottom middle, we have to pay off the interest that's bad debt first. So if your credit card has maybe 20%, 24% interest, you want to pay those higher debts down first, as opposed to lower percent interest debts.
So taking the risk of being misunderstood, that's what I do for a living anyway, so I'm okay. I think one of the silver lining of this crisis perhaps is for the younger generation, and I'm not saying that Sean is one of those younger generation, but majority of the younger generation really don't have a good understanding of economics, financial issues, and this work-life balance type of focus, where things are like if it wasn't important because it's given. So things are being kind of taken for granted. So the phone example is a good one. So I didn't get a new one last year. This year, when this was, I was getting it, I asked if it was part of the upgrade. I didn't want to pay $1,200 for a new phone because I didn't need it. Now, I'm a businessman and I can afford it, but we are talking about students who are getting the latest iPhone or whatever the other phones are out there, latest iPads, latest gadget that's out there, traveling and trying to just take themselves too seriously almost, where like, oh, I'm so important, so I have to just get everything done before I'm 25, 26. That's not the case. So we all have to work. So this recession that's already, we are not discussing whether or not the recession is coming. Recession is already here. So I checked the gas prices again before I was on my way here. So it's up to $3.65. Again, last November, it was at $2.60. It did go down a little bit in the, like maybe last month after this.
There's a little dip, but
like it's back to $3.60. So people, you heard Lydia saying the same thing. People have jobs. In fact, they may have more jobs than they need because they may be working for multiple jobs. I see a lot of elderlies working in groceries and the pharmacies as a cashier just for extra $10, $15 an hour. And I think part of the maybe silver lining is maybe this is how the new generation is going to learn and appreciate what we have. So, and it's not something that we can just take it for granted. Employee who wants everything, but knowing that what the employer's position is, employer can do only so much. It cannot just be give. Parents cannot just give you everything that you need. So we have to take responsibility, and this may be the teaching of nature, and it's a learning opportunity for us, perhaps, because we are going to bounce back from this. But the main thing is, what can we learn and how can we actually make certain adjustments for the future to have a better life? So before someone calls me old and depressing, I do want to finish up here. So we are going to discuss more stuff in the next couple of Fridays. We have a couple confirmed guesses, and we are open to do more events for those before the November 8th, which we are in contact with them. Next week we have.
Yep. So 28th, we're going to have Senator Sarah McBride and also Representative Minor Brown joining us for a joint session. So actually both going to be guests on the show for that our 2 p.m. hour, our UMACO live session, which we're on right now. And then we have a couple other ones that we're trying to see if we can get even maybe that Friday, November, I believe it's the 4th, maybe for one more Friday session in the beginning of November before the 8th when the elections are. So
sure. So, well, thank you for everyone watching us and following us. We'll be back next week. Bariatric Friday is back next Friday. Those patients, Patrick, Karen, and Denise, they are going through the process. Their surgery is coming up soon. Remember, these are real people, so we just renamed them. So it's really happening. So because
Yeah, we're just
from
following along.
the case
Yeah.
conferences every day, I do know who they are, so they don't.
Yeah.
So Dr. Erkan is going to be back with us. Thank you, everyone, and we'll see you next week. Bye-bye.